And what area of healthcare needs more investment and why?
Well, similar theme. I think we really need to focus on our seniors in the post-acute care business. I think the stat I heard yesterday was 12,000 people a day are now turning 65. The senior surge is here, and it's really been a part of our industry that's been underfunded, underserved, and we think technology can really make a difference in all of those problems out there.
Community research. There's so much out there on advancements in healthcare and science that don't reach the hard-to-serve, underserved communities in this country. Think about the number of life-saving clinical trials that don't touch populations that are underserved on healthcare. There's a lot we can do to be able to democratize access to research, and that's something that we believe in strongly at OmniHealth.
If you look at where the majority of the spend is going in healthcare outside of drugs, nearly 17% of all healthcare dollars are going towards just moving transactions between all the different healthcare entities. So we spend over $450 billion a year just making sure payments and claims and prior auth and eligibility happens. I think that's an area where we need significantly greater focus to reduce the amount of friction we have in the system.
Public health. 1,000,000% public health. And the reason I say that it should be public health is this is an area much like Medicaid was previously. I think more people understand how to invest in Medicaid and how to innovate there. You have to do a few more Googles, right, to figure out what state-by-state policies are and where the environments are. I know it's very hard. It's not like Medicare Advantage where everybody's just like flinging around dollars. But public health has been a little bit nascent from an investment perspective. There isn't a lot of innovation in that space. And part of that is because investors and startups don't necessarily understand how to navigate the very tricky funding environment. And so I think with a little education, a little bit of direction, we too can have innovation in public health in America.
I firmly believe that the technology that I have seen in the exhibition floors should be applied fair and square into rural health. We have got a massive issue in rural health. I know the infrastructure bill will add infrastructure where we can get connectivity, but if these guys could figure out a way, as opposed to going to work in New York or Chicago or LA, but how can you do this in West Virginia and Montana and Wyoming? I think it'd be amazing.
Yeah, so it's a great question. In general, cybersecurity is still a problem. We recently did a survey, and in that survey, we spoke to over 200 IT executives. And they told us that cybersecurity is the number one barrier to them doing more in the cloud and innovating. In fact, 56% of the respondents said that. And what's interesting is that even though they see that as a problem, 71% of them reported that their budgets are increasing. So despite it being a problem, and despite their budgets increasing, it still continues to be a major barrier. And so we think that companies really need to look at themselves and assess where are they in their journey and figure out, do they have the right tools, the right product, the right skills, and should they be looking at outside firms to help augment and provide those services for them? So, clearly doing more in the cloud, right, is going to drive innovation. And of course, we want to help them, and we think more investment in security is going to help them get there.
So I'm going to piggyback on my last answer, and I will say that right now you may know that there's a proposed rule that would impact the post-acute space that is requesting or would set limits for staffing minimums in the post-acute care space. But that proposed rule doesn't have any kind of financial backing with it. So we are seeing this at the national level, but we're also seeing at the state level where states are proposing staffing ratios. And there really isn't any financial backing behind it. So we need to address it in a much more broad way by infusing investment into nursing schools, educators. How do we actually build up more interest for folks to enter into the nursing profession?
A lot, but unfortunately, I'd honestly say still integration and interoperability. It's a problem that I've been working on for over 15 years. And the reality in the world is there's some great tools out there, but they're all still very cumbersome to work with and challenging to really get true liquidity of data in a free-flowing fashion. So I still think there's a lot of work to be done, a lot of investment to be done in terms of making those systems truly talk to one another.
Awesome. Thanks, Jeff.
All right, great. Thank you.